The next story is about chicken and egg, horse and cart when it comes to things that increase the risk of dementia. It's known that when someone's thinking abilities and memory decline, they develop a range of mental health issues, often depression and anxiety, at least to begin with. But could it go the other way? Could mental health issues raise the risk of cognitive decline and dementia? Maybe because they share similar causes in the brain. Well, a study of hospital and other records of nearly 2 million New Zealanders over a stretch of 30 years has found a dementia risk increase of perhaps 4 or 5-fold in people with mental health issues. But there might be more to it when you dig a little. The lead researcher was Dr. Leah Richmond-Reichert of the University of Michigan, Ann Arbor.
Thank you so much for having me.
I mean, this is an enormous study. What did you find?
We found that people who had been diagnosed with a mental health condition were about 4 times more likely to later develop dementia than those without a mental health condition. And this link was evident for many different types of mental health problems. For instance, people with depression, anxiety, substance use problems, psychosis, or who had engaged in self-harm were all at elevated risk for developing dementia as they grew older. And somewhat surprisingly, the link between mental health problems and dementia was actually stronger than the link between physical health problems and dementia. And the association that we found with mental health problems remained even after we accounted for people's histories of physical illness and their socioeconomic circumstances.
So what you're talking about there is particularly heart disease, which increases your risk of dementia.
That's right.
And was this at any age in terms of the diagnosis of mental health issue?
It was. So individuals were between 21 and 60 years old at the start of the study. And as I mentioned, we followed them for 3 decades. So they were between 51 and 90 years old at the end of the study. So this link was really evident across all ages that we looked at.
If you're diagnosing in hospital, it's likely that these people had more severe mental health issues. It's a very selected population, not necessarily representative of the New Zealand population.
Yes, this is a very important caveat, I think. Just as you've noted, Norman, this means that we would tend to capture mental health problems that are more severe in nature. So it does remain to be seen whether the link we found between mental health conditions and dementia would extend to less severe cases of mental health problems. We feel reasonably confident that it would. There's been findings from prior studies using different methods to measure mental health conditions that have also shown this link with dementia.
The other caveat might be is that there are people who study dementia who believe that dementia is actually a lifelong condition, which slowly declares itself through life. Could it be that these are people with dementia, which has just not declared itself, that in fact dementia is causing their mental health issue, it's just the dementia is not obvious yet?
Yeah, I think this is a really important point. So it is certainly possible that, mental health disorders and dementia might reflect some shared causes, or as you've noted, that people might experience a lifelong vulnerability to poor brain health that shows up as poor mental health in early life and as dementia in later life. But we feel reasonably confident that the mental health disorders that we've identified in our study are not simply early symptoms of dementia for a couple of reasons. A primary one is that we found this association across all ages. We also found that the symptoms of a mental health disorder were not coming online, very close in time to the symptoms of dementia. We also found this link for types of mental health conditions that are not frequently diagnosed early in the sort of onset of dementia or near the period of time of onset of dementia. So for instance, substance use problems. So all of those observations make us feel more confident that the mental health conditions that we are identifying are distinct from the dementia syndrome.
So the $64 question is intervention. In other words, was there any signal in your study that intervening made a difference?
We were not designed to test whether treatment or intervention for mental health problems actually reduced risk for dementia. And that's something that we're really interested in doing in follow-up research.
And the other question about intervention is that If this is cause and effect, the common pathway, according to a lot of research, is inflammation, is that you get inflammation, premature aging in the brain, which results in more mental health issues such as depression and dementia. In other words, the common problem is inflammation and premature aging in the brain, leading to depression and then dementia. None of the treatments attack that part of the problem. They're more superficial. They change your behaviour if it's psychotherapy, or they change the neurotransmitters, but they don't go upstream to that inflammation, which is why some people are talking about sleep and body clocks, changing your diet to a Mediterranean diet and so on and so forth. Is intervention in the current form of intervention likely to change the direction of this, even if it's got a common origin?
I think so. I think that, as you mentioned, inflammation may be one linking mechanism that we need to be thinking about. But I think there's several other ways in which mental health problems might raise people's risk for dementia. And the ways in which they might raise people's risk for dementia can also be important targets for intervention. So, for instance, people with mental health problems might find it more difficult to lead healthy lives, both physically and socially. So they might exercise less or drink alcohol excessively, have trouble staying socially connected. And all of these things might increase their risk for dementia. And there's other possible explanations as well. And even if mental health problems themselves are not leading to poor health behaviors or less social connection, these kinds of dementia risk factors are more common in patients with mental health problems. And so this suggests that it may still be important to be targeting some of these factors among people who are in mental health treatment that might still help to reduce risk for cognitive decline later on. Historically, we've been thinking about sort of assessing for and treating dementia much later in life. But our study really suggests that we might need to be thinking about these things much earlier in life, in the 20s, the 30s, and the 40s.
A much more whole person approach.
One thing I think it's important to note is that although dementia is not uncommon in the population, the majority of us will grow old without going on to develop dementia. And the same holds true for people who have mental health problems. So although mental health problems are a signal of risk for dementia, most people who have a mental health condition will not go on to develop dementia. And so mental health problems are not a life sentence that always results in dementia.
Leah, thank you very much for joining us.
Thank you so much for having me. I really enjoyed talking with you.
Dr. Leah Richmond-Rakert is in the Department of Psychology at the University of Michigan, Ann Arbor. This has been The Health Report. I'm Norman Swan.
I'm Tegan Taylor.
We'll see you next week.
See you then.